Whittier Street Health Center provides high-quality, reliable, and accessible primary health care and support services for diverse populations to promote wellness and eliminate health and social disparities. I'm Jenny Johnson for Comcast Newsmakers. At Suffolk University's downtown Boston studio, President and CEO of Whittier Street Healthcare, Frederica Williams, joins me. Welcome, Frederica.
Thank you for having me.
It's great to have you here. So now Boston is, of course, full of so many hospitals and clinics. So give us a sense of what makes Whittier unique when it comes to healthcare.
Whittier is a healthcare facility, but we're also focused on medicine, public health, and social services. We're very innovative. We're patient-centered and community-centered. So we meet the needs of the patients instead of focusing on just the issues they're presenting with. We focus on the family issues, the community issues. Because we're located in Roxbury, there are a lot of social issues that we address. So we look at how transportation, for example, impacts health, how education impacts health, how employment impacts health. So it's a holistic and innovative care that's focused on the whole person.
All right, so I want to talk a little bit about how on your website you refer to Whittier Street as helping urban healthcare.
Yeah.
So what is urban healthcare specifically, and how does it differ from suburban or rural healthcare?
Well, we're right in the inner city, in Roxbury. So being in the city, for example, where there isn't access to a safe space for people to exercise, physical fitness plays such a big role in our health. Nutrition plays a big role in our health. We're in a food desert. People don't have access to fresh foods and vegetables, and that's different from a suburban environment. So we are focused on the issues that impact people's health. In Roxbury, we have the highest mortality and morbidity rate for any chronic illness you can think about. So we're not just focused on people that are chronically ill. We focus on people that are at risk based on their environment and social issues. And so urban healthcare is very different. And with the change in demographics in Boston, I've lived in Boston 33 years. Boston is a majority-minority city with people from all different cultural backgrounds. We need to respect their cultural backgrounds as we teach them Western medicine.
Okay, so let's talk about some more of the pressing healthcare needs. You mentioned nutrition.
Yeah.
What are some that you see and some of the goals that you're trying to meet?
Diabetes is a major issue. Heart disease is a leading cause of death. Cancer is number 2. So for example, we have a partnership with Dana-Farber where we have a cancer center in our building. It's very unique. It's first in its kind in the country, where we're getting people into care early. In a city where we have all the best hospitals, black people are still dying of high rates from cancer and from breast cancer and prostate cancer. So if we can get them early into care and get them connected to the right type of care, then we can save their lives. So we're saving lives, we're transforming lives, we're improving the quality of people's lives.
So you mentioned a little bit about this, but talk about prevention and what kind of wellness programs Whittier's offering.
Yeah. So we have a lot of people who are at risk for diseases. I come from a family that is at risk for diabetes and hypertension, so I've changed my lifestyle. I've changed my behaviors. So we focus on education, on wellness, on teaching people how they can stay healthy. If they have chronic illnesses, we keep them healthy. We keep them out of the hospital. If they're at risk, we make sure that they do all the things that they need to do to stay healthy. And so our focus is on like going to the hospital where they're taking care of the issue, we prevent the issue.
So important. Prevention is so important. Now talk about quickly your green facility.
So we've built a state-of-the-art facility that's a green facility. What we're saying to Roxbury, it's a wonderful, beautiful building if you haven't seen it, 1290 Tremont Street. We're saying to the community, we're here to stay. This is a healthy environment, a healing environment, a welcoming environment that is LEED certified.
Wonderful. Well, Frederica, we really enjoy learning about Whittier Street Healthcare today. Thanks so much.
Thank you for having me.
Thanks for watching Comcast Newsmakers. I'm Jenny Johnson.